Welcome back to Sidebar Social. I'm Dana Stewart.
And I'm Jennifer Grinke. We had such a great time with Dr. Gilliland on our last episode that we decided to wear our same clothes, come back, and deep dive into the dashboard and how that affects and changes when substance get involved. Could you kind of talk to us a little bit, remind everybody kind of what the dashboard is?
Yeah, so it's one of the first things I look at when I see somebody, especially somebody that's going through a really difficult event. So I look at who are the people you're staying connected to, your community, which is really important to our psychological health. And then your purpose, where are you working, where are you investing, where are you needed by other people? Your play, your hobbies, where do you get a chance to step away from all of that stuff? And then looking at your brain and your body, your psychological health, and then your physical health. Are you sleeping? Are you physically active? Are you eating some quasi-healthy food that's kind of natural? Kind of natural. I mean, I have to be really gracious.
Says that on the label?
Yeah,
yeah. Kind of natural.
Yeah.
And so, here's a fun fact. If you're trying to eat healthy, stay on the outside of the grocery store.
Yes.
I learned that from great nutritionists in Cooper Clinic. Everything up and down the aisles, you're going to run into trouble with a lot of added things. Stay on the outside. It's how things are closest to how God created them. So when I look at folks and how they're doing, when I start to see them withdraw from other people in community or have trouble with sleep, I always ask about their alcohol use or pot use these days, because you see a lot of that as well as states are making it more and more legal. Because humans are vulnerable to use something to try to fix something. And when we're really stressed and worried and can't sleep, one of the common mistakes we make is thinking alcohol will help me sleep.
And what can you go into a little bit? What does, if you use alcohol, how does that impact a person's sleep or their sleep cycle?
Yeah, it's actually really bad. It gives you a misperception, though, because alcohol does make you a little bit drowsy. And so you'll have this perception that it helps me fall asleep, which I won't argue. It may help you fall asleep. But when we study sleep rhythms and sleep labs of people that have had a little bit of alcohol, it disrupts our sleep cycle. So while you may fall asleep, your quality of sleep is not as good. And in particular, your REM sleep, which REM sleep is where our minds get recharged and rejuvenated. Deep sleep's where our bodies kind of get recharged and rejuvenated. So going through a difficult event, you need your best thinking. Well, alcohol, if you're using alcohol to fall asleep, 1 or 2 drinks a night, your REM sleep, your sleep that recharges your brain, is going to be compromised. And so you're going to wake up and not have your best thinking on hand. And if you do, your battery's going to run out pretty soon. And then you're going to be in that loop of drinking coffee in the afternoons, energy drinks, and now you've really disrupted your sleep. And then you're vulnerable to drink a little bit more because it's a little bit harder to fall asleep. Alcohol is terrible at pain relief, but I think we know that from the old Clint Eastwood Westerns. You don't do that if someone's going to dig in your skin to get a bullet out.
Oh, you don't pour...
you don't pour alcohol. No, don't do that. It also doesn't help with sleep, and it can cause other problems that people aren't aware of. And I just want to stop thinking about all this. Well, there are much healthier ways to do that without risking problem behavior.
Is it possible for somebody who's never had a history of a substance abuse problem to develop one during a divorce or on the onset of a divorce?
It is possible. Is it likely? May not be likely, because it actually takes quite a bit of time to develop an addiction to a substance. A couple of things we know: if you start young, if you're 12, 13, when you start using alcohol and drugs, you have increased your lifetime risk. And the second thing is, you don't develop an addiction overnight. It takes months and even years. Look at how most people consume alcohol in college. If you looked at collegiate drinkers across the board, not going to name any universities, some more than others, you would say, wow, about 30% of them, 25% are addicted. And yet, when we look at them 5 years, 10 years post-graduation, addiction rates are the same as the general population, which is down around 6%. And that's for a lot of people drinking several years. Now, don't get carried away with it. because you want to be careful about doing anything with regularity. And so when you drink large amounts over a long period of time, that's how you develop an addiction. So what I worry about is people that have increased their frequency, where they used to drink 2 or 3 nights a week and would have maybe 1 or 2 drinks. I'll see them go through something like a divorce where they'll drink 4, 5, 6 times a week. And now they've increased their frequency and their volume because they're having 2 or 3 drinks. And if you're doing that 5 or 6 times a week, it takes more to get the same effect. So if you used to have a glass or 2 occasionally to fall asleep because there'd been a stressful week or kids or work or whatever, well, if you're drinking more a week, it's not going to be a glass or 2 that makes you tired. It's going to be 3 or 4. So now you're raising your weekly rates of alcohol consumption. And that's not good for our psychological health or our physical health.
Tying into that, during COVID, I feel like we experienced clients who were increasing substance use, and it seems like just kind of anecdotally that it was probably a worldwide phenomenon.
It became almost like normal.
Yeah,
Let's
it
post
did.
a picture with your wine. I'm having a bottle tonight.
So did you saw that too?
We saw it a lot as well. Now, those rates have stayed up. They will eventually come back down, but you'll see people, back to your question, Jennifer, can people that have never had a problem start to have a problem? Well, they can have a problem with the way they're drinking, but not develop a drinking problem, like an addiction. But what's funny about those people is they probably tell y'all about it, right? Because it's abnormal for them. They're like, God, I'm just drinking more than I normally do.
Right.
I've heard them say it when y'all are around.
Yeah.
Right? Because they're trying to make sense out of it.
Like, it's my spouse, it's my situation.
Yeah, and you go, look, I don't care what it is. It's your frequency and your amount that I'm concerned about. Because again, like we talked about the last time, this is one of the most emotional events people will go through. And you don't want to make it more emotional. You're trying to make it as stressful as it naturally is so that you've got your best thinking and decision making, because you're having to walk people through incredibly difficult decisions, like buying a house or selling a house or your kids' schooling. I mean, these are life decisions that you guys are in the position of talking about people with people in a really condensed way. And so they kind of say the things that I know, because when y'all call, it's like, oh yeah, no, they're talking about not sleeping or having a few more glasses of wine just to sleep. You're like, okay, that's not good. There are healthier ways to do that.
So one of the things I've learned through working with you is, I used to think, okay, you're an addict. It's black or white. You are, you aren't. But there's actually a spectrum there, right? And I know that we've received or seen reports where somebody could have mild substance use disorder or moderate or severe, and there's that range there. And so I think some people may have a lack of understanding that even some level of use, if they're ramping it up like what you're saying, can have detrimental impacts on their legal case or their family life, their friend group, their work. I'm just curious if you could speak to that a little bit.
Yeah, we think of alcohol and problems with alcohol as either or.
Right.
And fun fact, we changed our Constitution because we thought our problem was alcohol. And then we had to change it back because we realized, wow, it's not alcohol, it's humans. And you go, we can't get rid of them, so we're going to have to change it. Now, we haven't changed that document very much at all. And so it's not, oh, you have a problem. No, you don't. We know from research it lies on a continuum. There are about 30% of the population that just never drink. They don't like it. They don't like the taste. Just like coffee. Coffee tastes horrible until you keep drinking it long enough that you like it. Same with alcohol. And you keep drinking it because you develop a taste. Well, when we go through a difficult time, alcohol does something for us. And so you can end up drinking it in a way that you don't have an addiction, but you have a problem with the way you're drinking. And the more alcohol you drink, the worse your decisions get. You make bad decisions, you make emotional decisions, and what y'all see is a text message or an email or a video or posting something on social media that you go, okay, I'm sorry, that's not good parenting, or that is a horrible thing to say to another human. and especially one that you had been married to. And that's now going to be a part of this divorce process.
Yeah.
And y'all see it all
Yeah.
the time. That's the issue with alcohol. And I talk with people about, look, I'm not saying you have an addiction to alcohol. But what I am saying is that the way you're drinking is causing problems in this process. And it scares people.
Follow us and join the conversation on Instagram and YouTube at Sidebar Social. So I feel like the new craze are these skinny shots, the semaglutide. And so what role does that play when someone has an issue with alcohol or a substance abuse problem?
Yeah, it's definitely, it's one of the new problems we're having to deal with. I've worked with and had a chance to work with some really wonderful companies. One of those here in Dallas, the Cooper Clinic, Cooper Wellness Institute. Also do a lot of work for a company called Wonder Health, WONDR. Both those organizations have tremendous researchers, nutritionists, real big on being as healthy as you can for as long as you can. And one of the medical directors there, Dr. Tim Church, who is extraordinarily gifted and has done a lot of research, when these started coming out, I was talking with him about it, and he was like, he's a huge fan of it. My words, not his, but I think that's what he would say, because of metabolic syndrome or being overweight is the number one cost in healthcare for us. Because when we start to gain weight, we start to run the risk of having diabetes or insulin issues or cholesterol or heart disease. If I continue to gain weight, then it's hard on my joints. Those medications for the right people are a significant beneficial health effect. Now, the thing that's really challenging for a lot of people is when you take those medications, you don't feel normal hunger cues. And so your eating can dramatically reduce to where you don't have any fuel in the system. And especially protein that kind of keeps our muscle mass. If we overcorrect it, then we're at risk of having some other health issues. And when you drink on an empty stomach, everybody, even people that don't know a lot about alcohol, know don't drink on an empty stomach.
Yeah.
Learn the hard way once.
Right? Yeah, we've all done it once. That's a one-trial learning thing. Well, if you're accustomed to having a few drinks a week and you're going through something difficult and you're drinking a little more and then decide to start one of these, what you call them, skinny shots?
Skinny shots.
That's a great, that kind of it captures a whole group.
Yeah.
While I believe there are tremendous health benefits, it's also like some of the gastric bypass. They're very clear. If you have gastric bypass, your consumption of alcohol has to change dramatically because your intake of other food and how you process alcohol is going to change. And so we have to be mindful of that. And long COVID, as we're starting to do more research on things like long COVID, which it's not unusual. There's some other illnesses where we don't metabolize alcohol the same way. Long COVID is the same thing, is that there have been quite a number of people that have what medical professionals are calling long COVID that have lost the ability to break down alcohol. There are those illnesses and there are some medications that we have to adjust our alcohol consumption based on that illness or that new medication.
Yeah. So could it appear that someone has a substance abuse problem if they're using these skinny shots and drinking and they're having, like, let's say 1 drink or 2 drinks, which normally they could handle, but because they're having the skinny shot as well, they're acting more drunk than they would have?
Yeah, they're acting far more bizarrely and intoxicated, which, again, in the midst of a divorce, especially if there's children, it's one of the real worries. Y'all see this all the time. Parents worrying about the other spouse, what's going on when they're not in the home.
That's right.
Yeah.
And it's unbelievably hard for them, even when there's no substances. That is a real hard adjustment for parents to make. It's just incredibly hard. Well, now if there's any alcohol use or drug use by one of those parties, people get scared. Judges get scared. I get scared. And you go, oh, you said you only had 1 or 2, but that video or if that text message you sent, that's impaired judgment. And that's where you have to be mindful of some of those issues that you're trying to solve with what could be a good medication. You just have to make other changes, because we often overeat and overdrink and oversmoke when we're stressed. We do. We're all vulnerable to do that. And going through what feels like the worst thing you've ever been through, you just know there are things you need to keep an eye on, going back to that dashboard to go, okay, what's my food? What's my consumption of those things that will weaken my psychological health?
Yeah, and I think a lot of clients don't realize that one of the indicators a judge might use to test for that is the blood, alcohol, the PEth test.
Yes.
And so if you go into a hearing drinking, I mean, how could that affect their case if it catch them at a bad time?
And I think that's one of the things that maybe only we know. I can't tell you how many people I see. They're like, oh, well, they can only measure alcohol through a breathalyzer. No, not true. When I get court appointed, I always ask for a blood test so that I can see if there's alcohol consumption in the prior 4 weeks.
Right.
Yeah.
4 weeks, people. You heard that. You heard that right.
That's a
Yeah.
big
4
detection
weeks. Because it's important if there's been a question about overconsumption when I'm court appointed, or if I'm working with folks like y'all, okay, well, I want to know. And so give me some biological measures. Yes, there's a urine test, which gives you about 80 hours. There's a PEth test, which is a blood test that gives you about 4 weeks. And then there's hair and nail that gives you about 3 months of alcohol or drug consumption. So be mindful that we have a way to detect those things.
To learn more about Grinke Stewart Family Law, visit GrinkeStewartLaw.com. All right, so let's get back to the psychological dashboard, as you called it. I'm going to use that. I love that.
Yeah.
So one of the pieces you mentioned earlier was connection.
Yeah.
And you even said sometimes if you're working with somebody and you see them maybe losing the connection, like they're withdrawing, and that could be a red flag. But how important is it the company you keep? Like, what if somebody's not losing their connections, but they're hanging out with the same knuckleheads that are making poor decisions? How could that impact?
Oh, huge. And yes, it means our parents were right. It pains me. I know. Gosh, I may be getting old, but I feel like it's too soon to sound like my dad.
Yeah.
Who you're with in your community is critical. People, from a research standpoint, people that smoke have friends that smoke. Obese people have obese friends. Runners have running friends. So spend time being thoughtful about the community you're investing in, especially when you're going through a difficult time. Because there are times that we don't feel like it, but the community supports it. So if you find somebody that you can meet to go walk with, or work out with, or do any healthy hobby, hang on to them. Because there'll be times you go, not because you feel like it, but because you don't want the hassle of telling them you're not going to be there. Or of coworkers that you know are eating healthy or starting to walk around the office just to be physically active, connect up with them. Life gets easier when we hang around people that are doing or trying to do the same things that we're doing. It's one of the cheat codes that we all need to take advantage of. So put yourself in communities with people that are already doing or trying to do the things that you're advocating. So it just gets easier. And by the same token, if you want to change how you consume alcohol, stop going to the bar. You can still go to restaurants, and you can be more thoughtful about what you order, whether it's to save money or because it's healthy. Get some water or tea, or have one glass of wine and then have a glass of water or a glass of tea. There are lots of things that you can do to still enjoy some of those places, but not have them be sort of that core of healthy choices.
And so you're talking about the psychological dashboard. Why that moniker over mental health dashboard?
Yeah, look, I'm a psychologist and don't even like the term mental health. I mean, when we say mental health, and I'm not opposed to it or any of the diagnostic terms we have, but when you say mental health, you mean a very specific thing, and it conveys a severity level. And the mistake we all make, myself included, is, now I'm not that bad. I don't need that. We go, well, we don't do that in other areas of healthcare. I mean, if you kind of have chest pain, you're going to go to the doctor, right? You go, it's not that bad. I can still feel my arm. No, go if you feel a symptom or you have a pain. You're going to go and get checked out. I don't like the way we all push mental health to the extreme. It is a severity. It is a diagnosis. I don't mind that. But I'm much more open to talk about psychological health and interested to talk about psychological health than I am mental health. I mean, mental health is a very specific thing. If we want to talk about depression or anxiety or addiction to substances. But what we all need is some psychological muscles, because we're just not built for the world like it is today. Yeah. We have social media and information pushed our direction in an alarming way. We don't get help from our jobs of you're done at this time and go home. We take work home with us. We all do, with our computers and our cell phones. And so managing that flow of information and our psychological health is more important now than it's ever been. And it's a broader term. We talk about the psychology of business, the psychology of sports. If you watch the Olympics or any playoff, anything, they talk about the psychology and the psychological advantage. And we all enjoy that. And learning of, hey, how did this remarkable woman or remarkable man go through that? And what were the things they did to get through that? And that's psychology. That's human behavior. And I think broadly speaking, we all have an interest in that. And so I think for me, it makes it a lot easier for people to step into and get help for a really unique and difficult thing like going through a divorce.
Dr. Gilliland, it's been great to have you on today. You're just a wealth of information on these issues that we often all struggle with, not only in divorce, but in everyday life. We hope to have you on again.
I hope so. And I mean it. I said it the last time. I sincerely appreciate how you do what you do. It's incredibly hard, and I love the way y'all care about the people that come through your door. So I'll be here whenever you want me to.
Perfect. So, I always tell clients, I don't know the answer, but I know a guy who does.
Yeah.
Oh, man, that feels like a lot of pressure.
Yeah.
All right, we'll see you next time on Sidebar Social.
Bye.
To connect with today's guest, Dr. Kevin Gilliland, follow him on Instagram at dr_KevinG. And to learn more about his practice, go to drkevingilliland.com.